You're 64 years old, sitting in your doctor's office, and she just told you your blood work looks fine. Good cholesterol, good blood pressure, everything normal. But here's what she didn't tell you. Those numbers only show part of the story. There are 7 other signals your body is sending right now that predict your health for the next 20 years better than any blood test ever could. My name is Richard Morrison. I'm 71 years old. I spent 35 years as a registered nurse working in cardiac care and rehabilitation. I've seen thousands of patients come through those doors. Some of them at 80 were vibrant and independent. Others were struggling at 60. And I'll tell you something that surprised me. The difference wasn't in their medical charts. It was in these 7 subtle signals their bodies were sending that most doctors never look for. 3 months ago, my neighbor Tom asked me to come look at something. He's 68, same age as my younger brother. Tom showed me his hands. "Look at this," he said. "My fingernails have these vertical ridges. My wife says it's nothing, but I don't know." I looked at his nails. Then I looked at his eyes. Then I asked him one question. "Tom, how's your sleep?" He was stunned. "How did you know?" "I haven't slept well in 2 years." Those ridges weren't just about his nails. They were his body trying to tell him something. And I'm going to explain exactly what in just a moment. Before we go further, I want you to subscribe to this channel. Because what I'm about to share isn't common knowledge. Most doctors won't tell you this because they're focused on treating disease, not recognizing wellness. But these 7 signals can tell you whether you're on track for healthy aging or heading toward problems. Let's start with signal number 1. Your resting heart rate is between 60 and 75 beats per minute. Right now, find your pulse. Put 2 fingers on your wrist or your neck. Count the beats for 15 seconds. Multiply by 4. That's your resting heart rate. If it's between 60 and 75, your cardiovascular system is working efficiently. Your heart doesn't have to work harder than it should. Each beat is strong enough to pump blood through your entire body without strain. But if your resting heart rate is consistently above 80, your heart is working overtime. And a heart that works overtime wears out faster. A study from the Framingham Heart Study followed 5,000 people for 30 years. Those with resting heart rates above 80 had significantly higher rates of heart disease, stroke, and early mortality. Not just slightly higher, dramatically higher. I had a friend named Donald. He was 62. Always said he felt fine, but his resting heart rate was 92. I told him he needed to see his doctor. He waved me off. "Richard, you worry too much. I feel great." 2 years later, Donald had a heart attack. Not a massive one, but enough to require stents. When I visited him in the hospital, he said, "You tried to tell me, didn't you?" His body had been sending signals. He just hadn't been listening. Your resting heart rate tells you how efficiently your cardiovascular system is functioning. It's not just about your heart. It's about your entire circulatory system, your blood vessels, your lungs, your body's ability to deliver oxygen to every cell. If your resting heart rate is in the healthy range, you're doing something right. If it's not, that's information. Not a death sentence. Information. And you can lower your resting heart rate through consistent moderate exercise and stress management. Check your pulse tomorrow morning before you get out of bed. That's your true resting heart rate. Write it down. Then check it again in a month. You want to see it stable or declining, not climbing. Signal number 2. You wake up needing to urinate, but not more than once per night. I know this seems odd to focus on, but hear me out. Your bladder function tells you something important about your nervous system, your hormone balance, and your hydration status. When you're sleeping, your body produces a hormone called vasopressin. This hormone tells your kidneys to slow down urine production so you can sleep through the night. When you're young, this system works perfectly. But as we age, vasopressin production can decline. Waking up once to urinate is normal after 60. Your bladder capacity decreases slightly, and your vasopressin levels aren't what they used to be. That's expected. But if you're waking up 3, 4, 5 times per night, your body is telling you something is off. It could be your prostate if you're male. It could be diabetes affecting your kidneys. It could be a urinary tract issue. Or it could simply be that you're drinking too much fluid in the evening. I worked with a patient named Edward. He was 66. He told me he woke up 4 or 5 times every night to urinate. He'd been doing this for 2 years. He thought it was just part of getting older. We sent him to his doctor. Turns out Edward had early-stage diabetes that hadn't been diagnosed yet. His blood sugar was high enough to make his kidneys work overtime, filtering excess glucose and producing more urine. Once we got his diabetes under control, he was back to waking up once per night. His sleep improved. His energy improved. Everything improved. Your nighttime urination patterns are a window into your metabolic health. 1 time per night is normal. 0 times is even better. But multiple times suggests something needs attention. Pay attention this week. How many times are you getting up? If it's more than twice, talk to your doctor. Don't assume it's just aging. It might be, but it might not be. Signal number 3. Your skin bounces back when you pinch it. This one is simple to test. Pinch the skin on the back of your hand. Hold it for 2 seconds. Let go. Watch what happens. If your skin snaps back immediately, you're well hydrated, and your skin elasticity is good. If it slowly creeps back into place, staying tented for several seconds, that's a sign of dehydration or declining skin elasticity. Why does this matter? Because your skin is your largest organ. How it behaves tells you about your hydration status, your collagen production, and your overall tissue health. Dehydration in older adults is incredibly common and incredibly dangerous. As we age, our sense of thirst diminishes. We don't feel thirsty even when our body needs water. And chronic mild dehydration affects everything: your cognition, your kidney function, your blood pressure, your energy levels. I knew a woman named Catherine. She was 69. She complained of feeling foggy all the time, couldn't concentrate, felt tired constantly. Her doctor ran tests. Everything came back normal. I visited her one afternoon. I did the skin pinch test. Her skin stayed tented for 5 full seconds. "Catherine," I said, "when's the last time you had a glass of water?" She thought about it. "I don't know. I had coffee this morning." She wasn't drinking water at all. Just coffee and maybe some tea. Her body was chronically dehydrated, and it was affecting her brain function. We got her drinking 6 glasses of water a day. Within 2 weeks, the fog lifted. She had energy again. Her skin looked better. All from proper hydration. Research suggests that even mild dehydration of just 1–2% can impair cognitive function, especially in older adults. Your brain is about 75% water. When you're dehydrated, it literally shrinks slightly. That affects how well it works. Pinch the skin on the back of your hand right now. Does it snap back immediately? If not, you need to drink more water. Start with 1 extra glass per day. Your body will thank you. Signal number 4. You can see your food clearly without squinting or holding it at arm's length. Vision changes are expected as we age, but there's a difference between needing reading glasses and struggling to see things clearly, even with corrective lenses. If your vision with glasses or contacts is still sharp, if you can read regular print without straining, if you can see faces clearly from across a room, your eyes are aging well. But if you're noticing progressive blurriness, difficulty seeing in low light, or trouble with glare, those are signals worth paying attention to. Your eyes are direct extensions of your brain. The health of your retina, the blood vessels in your eyes, they reflect your overall vascular health. Problems with vision can indicate problems with blood flow, problems with blood sugar, or early neurological changes. I had a patient named Frank. He was 67. He mentioned to me casually that his vision had gotten blurry over the past 6 months. "Just getting old," he said. But something about the way he described it concerned me. He said it was especially bad in the morning and got a bit better during the day. I sent him to an ophthalmologist. Turns out Frank had significant narrowing of the blood vessels in his retina, a sign of cardiovascular disease. Further testing revealed blockages in his carotid arteries. He was at high risk for a stroke and didn't even know it. They put him on medication, changed his diet, got him exercising. 6 months later, his vision had stabilized. But more importantly, they'd caught a serious cardiovascular problem before it caused a stroke. Many specialists believe that regular eye exams after 60 aren't just about vision. They're about detecting systemic health problems early. Your retina is the only place in your body where a doctor can look directly at blood vessels without surgery. What they see there often reflects what's happening throughout your body. When was your last eye exam? If it's been more than a year, schedule one. And pay attention to changes in your vision. Sudden changes, progressive changes, any changes. They might be telling you something important. Signal number 5. Your nails are smooth, pink, and grow at a consistent rate. Look at your fingernails right now. Are they smooth, or do they have vertical ridges? Are they pink or pale? Are they thick and healthy, or thin and brittle? Your nails are made of keratin, the same protein as your hair. They grow from the nail matrix, which is fed by small blood vessels. How your nails look tells you about your circulation, your nutrition, and your overall metabolic health. Smooth, pink nails with no ridges indicate good circulation and adequate nutrition. But vertical ridges, especially deep ones, can indicate nutritional deficiencies, chronic stress, or declining circulation. Pale nails can indicate anemia. Yellow nails can indicate liver or lung problems. Brittle nails that break easily can indicate thyroid issues. Remember my neighbor Tom from the beginning? Those vertical ridges in his nails were a sign of chronic stress and poor sleep quality. When your body is under constant stress, it redirects resources away from non-essential functions like nail growth. The result is ridges, weak nails, slow growth. We worked on his sleep, got him on a consistent schedule, taught him some relaxation techniques. 3 months later, his nails were growing and smooth. The old ridged portions were growing out, being replaced by healthy nail. Often linked to overall health status is nail quality. A study from the Journal of the American Academy of Dermatology found that certain nail changes can predict cardiovascular problems, respiratory issues, and metabolic disorders months or even years before other symptoms appear. Your nails aren't just cosmetic. They're health indicators. Look at them closely. Smooth and pink is what you want to see. Anything else deserves a conversation with your doctor. Signal number 6. You have one solid bowel movement per day, usually around the same time. I know this isn't pleasant to talk about, but your digestive system is one of the most important indicators of overall health, and your bowel patterns tell you whether it's working properly. A healthy digestive system produces one well-formed bowel movement per day, usually within an hour or two of the same time each day. This consistency indicates that your gut motility is normal, your hydration is adequate, and your fiber intake is sufficient. But if you're going several days without a bowel movement, or if you're going multiple times per day with loose stools, those are signals that something is off. Chronic constipation can indicate inadequate fiber, dehydration, medication side effects, or more serious issues like thyroid problems or bowel obstruction. Chronic diarrhea can indicate infections, inflammatory conditions, or malabsorption issues. I worked with a man named Gerald. He was 70. He told me he only had a bowel movement every 3 or 4 days, and when he did go, it was difficult and painful. He'd been dealing with this for years, thought it was normal. It wasn't normal. Gerald wasn't drinking enough water, wasn't eating enough fiber, and was taking a medication that made constipation worse. We addressed all 3 issues, got him drinking more water, eating more vegetables and whole grains, and his doctor switched his medication. Within 2 weeks, Gerald was going every single day like clockwork. He told me he felt lighter, had more energy, and his chronic stomach discomfort had disappeared. Research suggests that bowel regularity is linked to overall gut health, which in turn is linked to immune function, inflammation levels, and even mental health. Your gut and your brain are connected through what scientists call the gut-brain axis. When your gut is healthy, your brain function improves. Pay attention to your patterns. Once per day is ideal. If you're not there, look at your water intake, your fiber intake, and your medications. Small changes can make a big difference. Signal number 7. You sleep 7 to 8 hours and wake up without an alarm. This is the most important signal of all. Quality sleep is the foundation of everything else. When you're sleeping well, your body repairs itself. Your brain consolidates memories. Your immune system strengthens. Your hormones balance. But quality sleep isn't just about hours. It's about consistency. Going to bed around the same time each night. Waking up around the same time each morning. Falling asleep within 20 minutes. Sleeping through most of the night. Waking up feeling reasonably refreshed. If you're doing all of that without sleeping pills, without alcohol, without relying on an alarm to wake you, your body's circadian rhythm is functioning well. Your nervous system is balanced. Your stress hormones are regulated. But if you're lying awake for hours trying to fall asleep, waking up multiple times throughout the night, or sleeping 9 or 10 hours and still feeling exhausted, those are signals that something needs attention. I had a colleague named Martin. He was 65. He told me he couldn't remember the last time he'd slept through the night. He'd wake up at 2 a.m. and lie there for 2 hours before falling back asleep. Then his alarm would go off at 6 a.m. and he'd feel like he hadn't slept at all. We talked about his routine. He was drinking coffee at 4 p.m., watching television in bed until he fell asleep, keeping his bedroom at 74 degrees, all things that interfere with sleep. We changed everything. No caffeine afternoon, no screens an hour before bed, bedroom temperature at 67 degrees, a consistent bedtime routine. 2 weeks later, Martin was sleeping 6 solid hours. A month later, 7 hours. He woke up naturally without an alarm. He told me he felt 10 years younger. Research suggests that sleep quality declines with age, but severe sleep problems aren't inevitable. They're usually the result of habits, medical conditions, or medications that can be addressed. How did you sleep last night? Did you fall asleep easily? Did you stay asleep? Did you wake up feeling rested? If the answer to all 3 is yes, your body is doing something very right. If not, it's worth figuring out why. Now, I want you to think about these 7 signals. Resting heart rate between 60 and 75. Waking up once or less to urinate. Skin that bounces back when pinched. Clear vision with correction. Smooth pink nails. 1 daily bowel movement. 7 to 8 hours of quality sleep. How many of these do you have? Maybe all 7. Maybe 5. Maybe 3. Wherever you are, that's where you are. No judgment. Just information. These signals aren't guarantees. Having all 7 doesn't mean you'll never get sick. But it does mean your body's basic systems are functioning well. You're giving yourself the best odds for healthy aging. And if you're missing some of these signals, that's valuable information too. It tells you where to focus your attention, where to make changes, what to talk to your doctor about. I think about my father. He died at 68 from a heart attack. Looking back, he had none of these signals. His resting heart rate was in the 90s. He slept terribly. He was chronically constipated. His nails were ridged and pale. He couldn't see well even with glasses. His body was sending signals for years. We just didn't know what we were looking at. We thought those things were just normal aging. They weren't. They were warnings we didn't understand. That's why I'm sharing this with you, because these signals matter. They're not just interesting observations. They're your body's way of communicating with you. And the better you get at listening, the better you can respond. So what do you do with this information? First, go through each of these 7 signals. Honestly assess where you stand, not to judge yourself, but to understand your current status. If you have most or all of these signals, acknowledge that. You're doing something right. Your daily habits, your choices, they're working. Keep doing what you're doing. If you're missing several of these signals, pick one to focus on. Just one. Maybe it's improving your sleep. Maybe it's increasing your water intake. Maybe it's getting your vision checked. Start there. Because when you improve one signal, Others often improve automatically. Better sleep improves your heart rate variability. Better hydration improves your skin elasticity and your bowel regularity. Better vision care can detect problems before they become serious. Your body is always talking to you. These 7 signals are part of that conversation. And the more you pay attention, the more you understand what your body needs. I'm 71 now. I have all 7 of these signals. Not because I'm special, not because I have good genes. My father died young, remember? I have these signals because I pay attention, because I respond when my body tells me something is off. And you can do the same thing. Starting today, check your resting heart rate, notice your urination patterns, test your skin elasticity, look at your nails, pay attention to your digestion, assess your sleep quality, schedule an eye exam, small acts of attention that add up to years of healthy living. If what I've shared today made sense to you, I hope you'll subscribe to this channel. This is what we talk about here. Practical health wisdom for those of us over 60. Not fear-mongering. Not selling miracle cures. Just honest information that helps you understand what your body is telling you. And if you know someone who could benefit from this information, share it with them. Sometimes we need someone to point out what we've been overlooking. Sometimes we need permission to take our body's signals seriously. Thank you for spending this time with me. Listen to your body. It's trying to help you. These 7 signals are just the beginning of that conversation. I'll see you in the next one.